struggling with knee pain, it could be your hip internal or external rotation causing the problem. Here's a very quick test you can do right now to check it out. Lie onto your back, place one leg up into a 90-degree angle, then you want to literally pivot from the knee, the foot one way, back to the centre, and foot the other way. Do this on one leg, then do it on the other leg, and you want to see if there is a difference. So if you've done our hip mobility test, you might have found you've got one side slightly restricted than the other. Let me talk through what that's showing you. So if when you've got your leg up and you put your foot outwards and it's restricted, you've got restriction on your internal rotation of the hip. If when you put your foot in, it's restricted, you've got restriction on your external rotation of the hip. What we're looking for is the difference between the two. So you might find, for example, this one, your internal hip rotation does this, but your external is fine. Or you might find your internal rotation is fine, but your external rotation is limited. That's the differences that we're looking for. So the stretch we're going to do that's really helpful for this is called an aeroplane stretch. Now, we just want to find yourself like some handles you can lean on. It could be like a bench, it could be a barbell, anything just to help with your balance. It's not the easiest stretch, so bear with it. It takes a little bit of time to get the technique, but it's worth it once you get it correct. So what we're going to do is you want to stand with your foot away, place one foot up in the air, and I'm going to put a very slight bend in this knee. Then what we're trying to do is drop my right hip into my left leg. So I'm trying to drop my hip into my leg. I'm twisting right round, and my right shoulder will also dip round. What I'm trying to do is find a pinch in my middle of my hip here. If I have my leg too straight here, I'm going to feel it in my hamstring. If I have it too bent, I'm not going to feel anything at all. So you have got to find the fine line here. The other way, just to make sure you're doing it right, is make sure this knee is always facing forwards. You want to hold that for 5 to 10 seconds. So this is working our internal hip rotation. Next we want to go on to external. So we stay in this position, take ourselves back to the centre. Again, you want to make sure this knee is facing forwards. We're then going to rotate out. So we're going to lift my right knee up, and we're going to try and open up the hips whilst making sure this knee faces forward. I don't want this knee to collapse in as well. Here, you're working your external hip rotation. Again, you're going to hold for 5 to 10 seconds. Come back to the centre, regain your balance, and go back into internal. Okay, so when we go back into our external rotation, again, make sure that knee is facing forward, and you want to feel it on that inner thigh. That's where we're trying to open up that hip. Now, if you've got one side tighter than the other that we just explained at the start of this, that's the side you want to spend longer in. So if your internal rotation is more restricted, you want to spend longer in the internal part of the stretch than the external part. Don't ignore the external completely, but spend longer in the internal, and vice versa, depending on which restrictions. Give that a go. I try to do it a few times a week. It's going to take time, but over time, you should see your hip mobility and rotations improve.